From nagging throbs to sharp, take your breath away stings, we're breaking down the top 5 bones that, when broken, are nothing short of torture. All right, let's dive right in. Number 5, the femur. Imagine for a moment the sheer force required to snap the largest bone in your body. For an average person, it's about 900 pounds or 4,000 newtons of force to break the typical human femur. Known as the thigh bone, breaking the femur is not just painful, it's an ordeal that redefines agony. In a nutshell, it's the titan of the skeletal system. It not only supports the majority of the body's weight, but it also plays a pivotal role in movement. So when it breaks, the pain is not just intense, it's kind of catastrophic to the body. If it shifts at all, the muscles of the thigh are going to pull it in so tightly that the agony gets intensified because your muscles are making it worse. To be able to relieve the pain of an individual in this circumstance, you actually need to pull the leg in the other direction, stretching those muscles to give relief of the pain that the bone is actually causing in the thigh. Described by many as a searing, all-encompassing throb that radiates from the hip down to the knee, the pain is so formidable that in some cases, patients report a sensation so severe, it's as though their leg has been obliterated. And although, of course, pain is bad, what concerns doctors and healthcare providers like myself typically is that for some femur fractures, this is associated with significant blood loss, which can lead to hemorrhagic shock or potentially death if not treated right away. Surgery, typically involving metal rods, screws, and plates, is almost always required to realign the bone. And let's not forget the potential complications like blood clots, infections, and the possibility of the bone not healing correctly, leading to further surgeries. Number 4, the tibia and fibula. Next up, the dynamic duo of the lower leg. Whether it's a clean break or a shattered bone, the pain is truly off the charts for this bone pair. An experience that's hard to put into mere words. This isn't just a fracture, it's a life-altering event that can bring the strongest of us to our knees. The tibia, also known as the shin bone, and the fibula, its slender skeletal partner, both play crucial roles in supporting weight, movement, and stability. So when these bones break, the immediate onslaught of pain is not just intense, it's overwhelming. Patients often describe it as a sharp, excruciating pulse of torment that renders them unable to stand, much less walk. So why does this happen? I've seen patients come in with fractured tibia and fibulas from things like high impact trauma, such as sports injuries, car accidents, or falls from significant heights. Recovery from such fractures is a marathon, not a sprint. After the initial emergency treatment, which might include surgery to realign and stabilize the bones with rods, screws, or even plates, this is where the real challenge begins. Physical therapy will definitely be needed, and boy is it grueling, but a necessary step on the road to recovery. Anyone who's been to PT before knows it's filled with painful exercises that are designed to restore strength and mobility. So even though each session is kind of like a test of willpower against pain, it ultimately will help you back on your feet. Number 3, the pelvis. The pelvis is the area of the body below the abdomen that is located between the hip bones and contains the bladder and the rectum. It's sort of the epicenter of bones that connects the trunk to the legs and plays a pivotal role in bearing the body's weight when you're doing things like standing, walking, or sitting. So when this crucial structure is broken, oftentimes it actually means multiple fractures. Basically, the slightest movement is unbearable. Usually, a significant high-impact trauma causes this type of injury. Unfortunately, events like high-speed accidents or falls from significant heights. And you know you have a hip or pelvic fracture because the pain will be a significant sharp pain in the hip or groin, accompanied typically by swelling, bruising, and tenderness in the skin at the site of the injury. And although usually seen with intense traumas, pelvic fractures can also occur spontaneously or after minor falls in people with bone-weakening diseases such as osteoporosis. If a patient comes in with a broken pelvis, we always look to make sure that there are no other life-threatening conditions associated with it that have to be stabilized as well. Things like extensive internal bleeding and internal organs being damaged. Basically, the immediate goal is to control bleeding and stabilize the injured person's condition quickly. We have to worry about something called an open book fracture of the pelvis, where the pelvis opens up. It can lead to significant amount of pooling blood in the pelvis, and what we end up doing is putting a pelvic binder on there immediately to try to clamp down and get the bleeding to stop. You can lose significant amount of blood in the pelvis just like you would the femur, and can go into hemorrhagic shock if it's not under control quickly. Number 2, breaking the ribs. There's something uniquely terrible about breaking a rib, or heaven forbid, multiple ribs. I'm sorry in advance for any of you that have experienced it. I'm sure you can attest to the fact that it's not just the sharp stabbing pain that comes from the fracture, but it's the cruel realization that something as vital as breathing, suddenly becomes a source of intense discomfort. Basically, these bony arches protect our most vital organs and are more than just structural supports. They're the guardians of your lungs and heart. With the mechanism of the injury, it doesn't just hurt when the bone is broken. The surrounding muscles and tissues also get inflamed, adding layers to an already intense pain. When one or more of your ribs are compromised, bruised, or broken, this isn't just any pain. It's a relentless, sharp ache that intensifies with every breath, cough, or even the slightest movement. As a physician, we worry about the ribs, but other complications that come with having broken ribs. For instance, upper rib fractures can cause injuries to the large vessels that bring blood to and from the heart, and it's also not uncommon for a fractured rib to cause injury to the lung itself. So when you come to the hospital, we assess the entire situation and make sure there are no additional injuries we have to treat. Then from there, it becomes pain management. You can't put a cast on a rib fracture because you can't keep the chest from expanding. You need to take deep breaths. We'll give something called an incentive spirometer. You don't want to take shallow, splinting breaths because you increase the risk of infection, aka pneumonia, if you don't get the air moving in and out. Number 1, the vertebrae. Its central role in function and movement means that a break here is not just about the terrible pain, it's about the potential life-altering consequences that come with such an injury. Everything here from mobility to basic daily activities, the vertebrae is the literal backbone of it all. And an injury here could really take it all away in an instant. So the fear that accompanies a spinal injury often amplifies the physical pain, creating a mental torment as well. The vertebrae are the small, circular backbones that form the spine of the human being. Not only are they very structure that holds you upright, but they also surround and protect the spinal cord, as the spinal cord is the conduit of nerves that sends motor commands and sensory information from the brain to the rest of the body. The moment of fracture is often accompanied by a sharp, sudden knife-like stabbing pain that can often be accompanied by numbness, tingling, back pain, neck pain. And the aftermath is a lingering, throbbing ache that radiates and amplifies with every breath or cough or movement. If you just have a fractured area of the vertebral column and no additional spinal cord injury, the pain will be searing. It infiltrates the core of your body, impacting mobility, stability, and function, and it can affect every aspect of your daily life for years to come. If your vertebrae injury somehow impacts the spinal cord, that daily life disturbance quickly becomes a lifelong challenge. Remember, the human body is resilient, even though breaks are painful and they suck royally. Please do not let it get you down and impact the quality of your life. If you've ever endured a break, I want to hear about it from you in the comments below. Also, check out my new supplement company called Life Happens. If you enjoyed this video, definitely binge watch this entire playlist right here. It's packed with other painful injury breakdowns. And hit that subscribe button, turn your bell notifications on, and smack that like button for me. Thank you so much for watching, and stay healthy, my friends.